The last video for this week jumps to the end of the chapter and focuses on endocrine disorders. So variations in the hormone concentration and how sensitive the target cells are does have a noticeable difference in the body. So we can actually see the effects of this within the body. And so you're going to see the word hyposecretion a lot and hypersecretion. So hyposecretion, we know hypo means low, so that means the inadequate hormone release or not enough hormone is being released. And we are going to talk about different hormones that have hyposecretion, but that's in general what that term means. This can be from a tumor that makes the gland not able to secrete the hormone or not able to receive the signal to make the hormone. There's lots of examples. And keep in mind on this video, we're just going to go through a few examples. We can't ever talk about all the endocrine disorders. We're just going to talk about the most common. And so hyposecretion, we're going to see that quite a bit. And then hypersecretion is excess hormone release, so releasing too much hormone. Again, this can be from a tumor or an autoimmune disorder. So one of the easiest one is Graves' disease, which is where TSH, there's other autoantibodies that mimic the effect of TSH, causing too much thyroid to be secreted, and that's called Graves' disease. So a hypersecretion of growth hormone can look different in different people or in different ways. But so we could see this thickening of the bones and the soft tissues in adults. We could have problems in childhood before the growth plates are depleted. If it's a hypersecretion, it would be gigantism, and then dwarfism if it was a hyposecretion. That's pretty rare since growth hormone is now made, and we can kind of get our hands on that relatively easily. And then the picture here is pictures of each of those. Well, diabetes, I'm not sure why diabetes is on this one, but some examples of photos of people with pituitary disorders. Some other thyroid and parathyroid disorders. Thyroid disorders are very common. So congenital hypothyroidism is hyposecretion present at birth. The children can have oral thyroid hormone. I cannot talk. But you could also have adults with hypothyroidism, and again, you can treat that with oral thyroid hormone. And then you'll see goiter comes up quite a bit in endocrine disorders because it's an enlargement of the thyroid gland, and it can come from an iodine deficiency, no thyroid hormone, no feedback, and so then there's an increased thyroid stimulating hormone has too much of that circulating around. And so it usually looks like a big kind of growth on the neck where the thyroid gland is. Hypoparathyroidism, remember the parathyroid are those four little tiny glands embedded within the thyroid. So usually if you have hypoparathyroidism, they would be surgically removed, and you could then, the blood calcium level is going to decline pretty rapidly, because that's what the parathyroid does. If you have hyperparathyroidism, that's too much parathyroid hormone secreting. That could lead to a parathyroid tumor, too much calcium in the blood, too much phosphate in the blood as well. Cushing syndrome is an endocrine disorder of the adrenal glands, so it's too much cortisol, and so it can lead to hyperglycemia, hypertension, weakness, and sometimes it has different or abnormal fat deposition, and so you can look like a little moon face. This is in a child, obviously, of Cushing syndrome. And then the last two we're going to talk about is the two types of diabetes. So diabetes is the most common, most prevalent metabolic disease, and it does disrupt your metabolism due to hyposecretion or the inaction of insulin. Those are the two types. So symptoms of someone that's diabetic: excessive urine output, intense thirst, and hunger. And that is revealed by an elevated glucose level, glucose in the urine or ketones in the urine. We can test for all of those things. So let's look at the two types of diabetes. Type 1 is the one that we see onset in juveniles, and so that's 5 to 10% of the cases. In type 1 diabetes, insulin is always used to treat type 1. So insulin injections or a pump or an inhaler, depending on the severity. And they're monitoring their blood glucose levels throughout the day and have a controlled diet based on how far off their glucose levels are. This is inherited, and so that is type 1. But more commonly, 90 to 95% of people that are diabetics have type 2, and this comes on later. Some risk factors are older age, obesity, some ethnicities, and the problem here is insulin resistance. So the target cells are not responding to the insulin, even though there is insulin there. This is not treated with insulin unless it's a really dire situation. It's treated first with weight loss and exercise. The loss of the muscle mass can cause difficulty with the regulation of glycemia, and then the fat interferes with the glucose uptake. So that's our first plan of attack is weight loss and exercise, but can use medications, and last resort would be insulin. And that is all for our endocrine disorders, and that's it for the endocrine system.